All right, everybody, welcome back to another episode of the Chasing Edges podcast. We got an incredible human on today, Dr. Alan Butler out of Atlanta, Georgia. Is that where we're at right now?
North of Atlanta, yeah.
Gainsville. Gainesville, yeah. We met at the Sornex Winter Strong event and had a bunch of incredible conversations, so I'm excited to chop it up. But he is an ENT, which is obviously part of the world that I speak on all the time with the breath work, so I'm excited to dive in with him. But Alan, thanks for joining.
Thanks for having me.
Easy. What's going on in your world right now?
Like I said, taking call this weekend, so I'm homebound, and right now it's been kind of calm. I shouldn't say that, but right now it's calm.
We'll take calm when we're on call. That's always a good deal. But how I usually start the podcast off is just asking where you're learning right now. Where are you curious? Where are you chasing edges?
So right now I'm in the process of I've been in ENT for almost 30 years, and I love the field. Have recently gotten into not only the overlap in my field, but the overlap in exercise and the importance of breathing through the nose. And as a early athlete and the youngest of four boys, my nose has found its wrong place in the wrong time multiple times. And so always had difficulty breathing through my nose. And even after getting that corrected, was still doing a lot of mouth breathing. And so, have gotten really into the idea or the field that you're focusing in on as well, is this, the extreme importance of nasal breathing. And it really wasn't even stressed in my training as much as it's been kind of illuminated and is being discovered now.
Yeah, from what I'm understanding, like a lot of the research that maybe they would pump in school or whatever it ends up being is like coming out now as well, just with the spike in interest and the mainstream books and all these things. But obviously, and the discovery of the good benefits, both for performance and general health and sleep and everything along those lines. So I'm pumped. That's where your curiosity lies, because that's where my curiosity lies as well. What kind of piqued your interest to get into, is it just something that developed these last couple of years as far as like the nasal breathing and exercise?
So, I'm 50 years old and I try to stay in good shape, but you realize that you get to a point where you need every advantage you possibly can get to try to, maintain any sort of physical fitness or even competitive, status. And so, really just looking at all kinds of different avenues on where, diet, weight loss, all kinds of things I can do to try to find that edge. Okay. And I came across the book Breath by Nestor and started reading that and was just fascinated with some of the information I was getting, and that it just really, sparked my desire to look into this further and look at nasal breathing. And I think I expressed this to you as I cycle as well. And I've tried to get on the bike and close that mouth, man. And it's, when you first start, it feels like controlled drowning,
Yeah.
And it really, to really push yourself, you've got to see the end results. They've got to be there, and so it's so important to just do this and go out there and say, I'm just going to struggle with this and just beat my head against the wall. You're not going to do it. But if there's gain to be made, but sacrifice and skin has to be put in the game before you get that gain. And so that's what it's given me, is a little bit of inspiration to really push through my workouts and really force myself to nasal breathe, not only during exercise, but even during the day and at night. So many different areas.
Yeah, that sense of awareness to shift, it's easier, when you read the Breath by Nestor or the Oxygen Advantage, or even a couple other Patrick McCown books, that now I understand at least what's happening in the mouth and in the nose. I get compound interest on the benefits of the nose. So at least you have this switch of awareness. That's what I always just push it that way. Once you have the switch, now you can at least measure, track it, change it, those kind of things. But most people, it's just it's below their level of consciousness. But then when I get them into exercise with nasal breathing, I always kind of give them a disclaimer where it's a good way to say it, where it's you need to leave your ego at the door concept, because what's going to happen is, one, it's going to be the controlled drowning effect. It's going to be a lot of discomfort, but a lot of the research goes anywhere from 30 to 45 days. Some people adapt faster, and then Some of it's as long as like 6 weeks to 6 months, depending on like the gains they're looking for in the research. But it's all very interesting that like once you like can start to adapt the benefits and adapt your blood to the maybe another step up of CO2 tolerance, so that like again the hemoglobin dumps the oxygen into the cell. Now your times go down massively. I've seen, and the heart rate variability, it still stays high and that kind of thing, but their heart rates don't reach guys that I put on it with long distance running and lunging in particular. And then our hockey, it shows up in our hockey guys too, where workouts where they previously their heart rate would reach 180, 190. They won't even get above 160 once they like, but we haven't had a lot of guys, probably 10 to 12 that have truly committed to it. So, but like it takes a lot of discipline, a lot of ego. You got your times are going to get worse sometimes, but I think that's just such a cool thing. How long have you been doing the exercise nasal now?
So I had done it for about a month and then got sidetracked with, I had like COVID and then ended up getting a little bit of pulmonary issues. And it took me about a month and a half to get back into it. And that's kind of about where Winter Strong took place. Okay. And it was really inspiring to hear you talk there and go through some of your breath work. And so I've been doing it now for probably, it's been about a little less than a month maybe. And I'm back into it. I already can feel it. Like I'm not, when I first got back, I was having to do like breathe right strips.
Yeah.
And I would spray with Afrin before the workouts, so I didn't have that anxiety of controlled breathing. And now, I mean, I got up there yesterday and I've increased, the incline significantly, my duration consistently. I've been doing kind of a 1 in 3, cardiovascular workout where I hit it about 75% for about, a third, let's say 20 seconds. And then I rest and I just take it easy. So I've been doing those. And I've increased the number of intervals that I can do. And so it's just notable gains. And I haven't taken any data on that, but I already feel like I've made a huge improvement in just within the month.
Yeah, that's awesome. Yeah, so you're still fresh in it. You're about to start peaking some of those benefits. But yeah, if anybody that is listening, James Nestor's book Breath illustrates this really well. He goes through a couple experiments where he tapes his mouth for 10 days and he has this routine where he's on a bike and he's eating and sleeping the same way. And he does the same thing on and off. Now he plugs his nose and records and tracks all the benefits and differences and the wake ups and the heart rate variability and the heart rate that's reached is all just, it's story told really well to get the point across that like it is very effective to become a nasal breather, both during exercise and when you sleep. And I think, and throughout the day, but I just think if anybody that's listening hasn't read that book, I think it's just worth your time to hopefully change your view on the breath world, that it's not woo woo. It's not anything crazy. It's what I think how one reason why I'm excited to talk to you, because like, this is your world, like the nose is your world. And you already kind of touched on it, but like, anyways, the book's worth the time. But with you, you already started to mention some of I'm a big biohack habit guy. I'm into red light and all those things, but you already mentioned the breathe right strips and the Afrin to kind of like prime you for performance. Right. What's the goal of both of those, just to break that down, and then we'll get into some more of those.
So, as an ENT, one of the major problems we deal with is nasal obstruction. And there are a lot of different components and moving parts to that based on the person's anatomy. And so, for instance, when you see people and you ask them to close their mouth and maximally inspire through their nose, some people, you really don't see the side walls of their nostrils collapse. Other people, it just goes down very narrow. So that's nasal valve collapse. Okay. That's really where the breathe right strip is. You're going to get your money's worth. Okay. If you have a nose that you're not getting that collapse, you're probably wasting your time. So what it does is it prevents it from caving in as you inspire. And that's called the Bernoulli effect. So as you increase that airflow through that narrow passage, it's going to draw that wall in. So it narrows it.
And so is that just for my knowledge and everybody else out there, hopefully, because I don't know this, but so is that like is that nasal collapse a sign of like weakness and like of like cartilage muscle or anything like that, or is that just like the natural like mechanical function of it?
The dilating muscles of your nose are voluntary, And so you can work those. And that's why you can have people flare their nostrils. I mean, that's literally like working out. And so that muscle over time can stiffen. Okay. But you do have people that you look at and they just got a really narrow pointed nose, just a tiny nose. And that narrowness is they're more likely to have collapse. There are people that have had trauma to their nose. So they destroyed the cartilaginous structures, the septum, the nasal tip, and all those structures are so important. And so if those have been, damaged in a way, there can also be weakening. So you can be born like that. You can have had nasal trauma. Those are some of the things that lead to nasal valve collapse.
Then, so in that world, yeah, no, you're good. That I love the example, because like we see this as well, and then like it's been in a lot of books and research is one like your genetic past or like your hereditary structure that you've gotten, like obviously like because of like the temperature of the environment that your ancestors come from has bred some type of adaptation to your nose. So like I think it's super funny when like because I end up coaching anybody and everybody, but some of the brothers, some of the black guys on the team, it was very natural to them, and they could actually I felt like they adapted faster, and obviously that's very prevalent, and because they naturally are more prone to have larger air passageways, correct?
Yeah. So if you look at the Afro-American, they describe the physical characteristics typically of the nose as platine, and which is almost in translation, it's flatter. Okay. But if you look in there, they have a very wide base, and then the nostrils almost are open and go straight back. Now that's a generalization, but
yeah, for sure.
But basically, I would say that that's very, very strong information. That and that's why I think physically and athletically, you see a lot of those guys are just at the top of their game, and it's because of their anatomy, their muscle structures, all kinds of things. But that facial structure is very much a part of that, I think.
Yeah, I think that's massive, just because like we've seen guys like any type of human massively change their game once they've gotten to the nasal breath or like strengthen the breathing muscles and things like that. So I feel like any advantage there is just going to be compound interest on aerobic capacity and potentially even core strength and firing pattern down the road. So like that excites me as well. But so it's like obviously the nasal strips, like breathe right strips, because we again, I've preached it on this podcast a bunch, but the mouth tape while you're sleeping, so you get those those benefits. And then like when we on-ramp people onto the mouth tape, usually like we'll have them tape their mouth like an hour before sleep, so they can at least become consciously aware of the breath that they're about to partake in when they sleep. And then if they struggle and like have to take it off or whatever, we add the breathe right strip. But how effective is the Afrin?
So Afrin is extremely effective. Well, it's going to maximize your nasal decongestion in the dimensions of your nose. So Afrin is oxymetazoline, and it's an agent that causes vessels to spasm down. And so in the nose, we have tissue on the side of our nose that contracts and swells. And that's very important. There's a nasal cycle that's supposed to be there. So that swelling is very much a part of human physiology. And that's why people have a problem using Afrin chronically. You can't use it all the time, okay? Because then you alter that physiologic cycle. Then you cause nasal obstruction, okay? And I can go over that too if you want to. But the long and short of it, what's that?
No, it's just like now that just piques my interest. Like, I mean, it's like every substance, you can abuse it if it's all the time thing. But so just in my performance mindset's coming in where is it good to use just pre-performance?
Yes. Yeah. So I'll cycle probably 3 times a week, maybe 4. And so, I'll do it, in the morning, right before my workout, and it's once a day. And so once a day, and then you're not going to do it for another 24, 48 hours. That's fine. So spot use is good. Daily use, can't do it.
No, because I've seen people use it for allergies, like too much, correct? Like that's when people use it. Yeah, that's where but then we've also had these conversations in the past where but that, so is that membrane that's whatever contracting?
So that tissue on the side of the nose, typically you can get it to shrink. And so what that does is it causes that tissue to contract almost. So what you've done is you've maximally decongested somebody's nose. So there's no swelling really to speak of that's going to cause problems. And so most people, you spray them down with that, and like, man, I can breathe. Now I can breathe through my nose.
Yeah.
And so that gets people, back in the game, and it allows them to at least initiate that process, that you're talking about, getting those people on board.
Yeah.
And so.
Yeah, I like that a lot. And then as far as like the length of effectiveness of that treatment, how long does the Afrin last?
So let's say that somebody just has, they're just getting started. And so they just, for me, like I used it maybe for the first week, just getting back and getting used to breathing. And so like I said, I just, that increase in CO2, because you're having to breathe in longer and slower and out slower. And you really, you really feel those changes, and they're overwhelming. So it gets you through that period. There are people that are going to have anatomic issues that are not caused by, say, allergies and other things. And if they have a lot of our MMA fighters, people that have sustained facial trauma, they're going to have, a septal deviation. The septum is the partition in the nose that gives you a right and left side. That wall, in an ideal world, should sit right in the middle. If you have trauma, it can get bent and all jammed up to where it's blocking this side up front and then blocking the other side in the back. And so people really can't get airflow through there well. Okay. Those people are going to probably feel like they need Afrin all the time just to function. And so those are people that you may want to, if you really see somebody struggling and not kind of weaning themselves off of that, that's somebody who you say, I think it'd be really good to just go get an ENT evaluation of your baseline, your turbinates, which are the swelling structures on the side of the nose. Those can be enlarged with allergies and chronically enlarged, and they can be shrunken pretty easily. There are people that have that septal deviation, and that's a pretty simple surgery, quick recovery. That's going to make a huge difference in their ability to continue this long term and to get the gains we're talking about and the benefits.
Yeah.
So an ENT evaluation is probably recommended to somebody if they're not weaning themselves from it and they just can't seem to take it to the next level.
Yeah, we get that a lot. I mean, football players with their helmet coming down to the nose end up with breaks and deviated septums from time to time. And then obviously the fighters and wrestlers and stuff I've worked with, like I don't want to say the majority of them, but a lot of them do have the deviated septums. And I've even had a bunch of people ask through the podcast as far as deviated septums, and like, I have a deviated septum and I want to tape my mouth to potentially get these benefits. And like, I just steer them. I say, like, I'd get evaluated before you do anything crazy. But what as far as the deviated septum surgery, what's the procedure and what's the recovery time?
So, and this is speaking from experience because I've had this.
Yeah.
It's an outpatient procedure. So you come in, you get it done, you go home.
Yep.
This isn't a rhinoplasty. So this isn't a nose job. You don't have the facial swelling, the black eyes. It doesn't change the appearance of your nose. This is all done for function. And so there's a small incision done on one side or the other, just inside the nostril. You elevate the tissue off of that. There's cartilage in the front portion. There's bone in the back. So you elevate it off both sides. And then suffice to say, everybody uses a little bit of different technique. I typically do a lot more removal of cartilage because it's kind of like plastic. It has memory, wants to go back. And I don't like having to go back 5 years later and look at somebody and have to redo a surgery. So, but everybody does a little bit different technique. It usually takes 30 to 45 minutes and, trained hands. There's really not a lot of pain associated with it. Maybe a little bit of raw feeling the night of surgery. I give people pain medication, but they seldom take it. They'll hear horror stories about packing that people used to use. We used to put like 6 foot worth of Vaseline gauze in people's noses. And I mean, that is extremely uncomfortable getting pulled out. I had a broken nose multiple times and I had to do that when I was younger and it was miserable. We now use kind of some soft silastic splints. Those come out relatively easy. I take those out on day 4. And most people are, other than like I tell people, take it easy as far as sports because I don't want you to get hit in the nose because what I've done is easily, undone with minor trauma to the nose. And that, you're kind of at risk for bleeding for about 2 weeks. Bleeding isn't the end of the world, but you don't want to be in the middle of a competitive sporting event and have to quit because, you're bleeding from your nose. So I usually tell people to take it easy for about 2 weeks, light exercise, but pretty easy procedure overall.
All right. Yeah. That doesn't sound too intimidating. It's not like it's going to take you out of exercise for any crazy length of time either, which a lot of athletes worry about.
Yeah. People will, you'll kick yourself when you have it done, not doing it. You're like, I should have done that years ago.
Yeah, that's what.
Because now you can actually breathe through your nose. You got another hole in your face you can breathe through.
Yeah, one of my buddies just got it done probably a month ago, and he's ecstatic. Just because he can finally tape his mouth too, so he's pumped.
Right.
But one of the worries I've heard is like that because like, is there any like I guess permanence to the surgery that like can't be reversed? Is there like searing or anything to to keep the nasal passageway open? I don't know if that's a bad question.
Very few people have problems. Now, sometimes, in the past, if you try to remove too much tissue, right? So you correct the septum, maybe you reduce those turbinates on the side. There are people that have been very aggressive about that. And over the years, we've learned that that's a no-no.
Okay.
That's when you get something called empty nose syndrome. So these people, you look in there and you could drive a Toyota truck through their nose, but they will tell you, I can't breathe at all. Okay. And that is because of that nasal cycle we talked about. So I'm going to go into it here because you got it twice.
I love it.
So what happens is that you have structures on the side of the nose where typically one side will swell, the other side will constrict. And every 4 to 6 hours, they change sides. So the other one constricts, the other one swells. The one that is swollen is actually blocking off airflow and giving the nose a break. If we were to breathe through our nose all the time and never give it a break, it would get dry, it would crust, it would bleed, it would be horrible, okay? So that nasal cycle allows you to stop airflow through one side, the tissue gets nice and moist and wet, 4 to 6 hours later, it goes to work, the other one takes a break. So that's constant, okay? And so when you have somebody who has, the nasal passage is blocked up because of allergies, what have you, they don't ever recognize that cycle. If somebody has a nasal septal deviation and say their right side is blocked, well, the only time they notice that they can breathe, because it doesn't matter whether the left is open or closed, the only time they can breathe is when that left is constricted, right? Because that's their only good nostril. When it swells, they block up. So every 4 to 6 hours, they'll have problems with congestion. And then it opens up a little bit and then it closes up again. So that's representative of something that's either a septal deviation, what have you, okay? So empty nose syndrome, basically, if they get in there and remove too much, they never go through, they can't get, the nose can't get a break. So the tissue's dry, it's insensate, it doesn't work. And that kind of leads us into a little bit what you were interested in was atrophic rhinitis. So
yeah.
So
yeah, and that so like, because like initially I got triggered that like if I do breathe in through my nose, the first time you told me this, the first time if you breathe in through your nose all day, obviously like the ability to dry out the membrane and the cells and that kind of thing eventually cause atrophy per se.
No, maybe I misspoke.
No, I misheard you the first time. Gotcha. So like, and then
Gotcha.
So then once you started to explain the cycling and then like also how to maintain it, it makes a lot of sense, because I've dealt with a bunch of football players in particular where they can't breathe in aggressively through their nose. It like ends up burning, and like your explanation of that and the probable cause of that is what I guess incited this curiosity down the salines and those kind of things. But can you talk through the
atrophic rhinitis?
Yeah.
So atrophic. So trophic is growth. Atrophic is mean no growth. And then rhinitis is just inflammation of the nose. And so the main area that we see this in is our laryngectomy patients. And so these are the people that have the hole in their throat.
Yep.
They've had their larynx taken out. So now their airway has been separated from their nose and their mouth. So the only thing that their mouth is used for is putting food in and going down. Okay. So there's no respiratory function in the mouth or the nose at that point, because it's all coming through a hole in their neck.
Yeah.
Okay.
Crazy. Yeah.
So when we do this on patients, they're not breathing in through their nose. And because they're not using it, they lose it. So that tissue starts to it's never functioning. It's never stimulated. It just kind of atrophies and goes away. Our nose is constantly covered with mucus that's being produced by glands that live in that tissue. If you're not stimulating that tissue constantly, you're not getting that mucus production, that lubrication. Okay. There are also little micro-like, finger-like projections that sweep mucus from the front of our nose to the back of our nose. And that's very important. And so those cilia die. And they're just, if you biopsy those things, there's just nothing. They're just frozen. They're just limp and just flaccid and hanging there. So the tissue goes away. You literally lost function of that tissue because you weren't using it. That can be restored. Now, not in somebody who's had a laryngectomy, but in somebody that's a chronic mouth breather because of chronic nasal obstruction, or they just always breathe through their mouth. They're not stimulating that tissue. And that may take a while. And they will bitch and complain that it's burning or hurting or irritating. But eventually that function will come back. And that's where we talk about saline gels, and really just, babying that tissue while you're getting it back in shape.
Yeah, which is awesome. So as far as like the maintenance for that goes, the product you use and what it's doing.
So typically there's a lot of products on the market these days. They have recognized the importance of keeping the nose clean and healthy. And so the easiest way to do that is saline. Okay. I like the products that are already pre-made just because I'm lazy. Yeah. And I don't want to have to be sitting there, boiling, distilled water, and all this other stuff. So some of the products are already pre-made, ready to roll. And I like those products. That one is in a little squeeze bottle, and you spray it and the mist comes out the top. The other one's in a pressurized can. And so typically what I have people do is just maybe 2 or 3 times a day. It's just like brushing your teeth, just good hygiene for the nose, is look straight down at the sink, spray straight to the ceiling, 4 or 5 sprays on either side. Sniff that back a couple times, not going down your throat because the stuff tastes nasty, but just enough to get to the back. Think of waves washing up on the beach and back into the ocean. Yeah. And then just blowing the nose. Okay. So doing that routinely, not when you feel bad, not when you feel congested, every day like you brush your teeth.
Yeah, I love that.
And so, yeah. And so the other products out there, there's like the Neomed bottle, and I'm not bad mouthing any products, but they sell you a bottle, they sell you salt packets. You got to go buy distilled water. You got to heat that up in a microwave to boiling. You pour off what you don't need. You put the salt packet in there, stir it up, let it cool down, and then pour it in the plastic bottle. And it feels like you're being waterboarded. I can't believe they can sell them. I'm not a big fan.
Yeah,
people are going to do it. My patients won't do it. That's what it really boils down to. So they'll use those products if they're easy to use.
Yeah,
easy and convenient.
Yeah, I'm definitely a pre-made guy when it comes to all my biohacks, et cetera, besides maybe like the ferments I make for like my digestion and that kind of thing. Is there any other, so like, is there, as far as like no-nos in the world, is there any products that like are like pretty mainstream that you think cause problems in your world, or even to the nose in particular?
One other thing, obviously routine cocaine use causes vasoconstriction. I see it a lot, believe it or not.
No, I believe it. Cocaine's habits are real. Yeah.
Yeah. And so that, very much like Afrin, causes vasoconstriction. The cartilage in our nose, which makes up the major third of like the projection of the cartilage off the nose, is made up of cartilage. It gets its blood supply from the overlying tissue. It literally does not have a direct blood supply. It drinks from the tissue. And so when you use things like Afrin or anything that causes vasoconstriction, you shut off that blood flow long enough to that cartilage, it will die. And you can put a through and through hole in your septum, have crusting, bleeding, all kinds of major problems. So chronic use of nasal decongestants and things like cocaine or anything that causes vasoconstriction is a problem. Something I've seen recently, which is really needs to be brought to the attention, is that, so everybody knows to stay away from Afrin, but then they sell it as 12-hour nasal spray or oxymetazoline, Mucinex. Okay, Mucinex is a great product, but they're starting to brand Mucinex nasal spray, and it's just oxymetazoline. It is Afrin. And I see people using it all the time. Like, I'm not going to use that Afrin stuff, but I'm drilling Mucinex over here. Yeah. So there's a lot of products. They really got to look at the products, and if it contains oxymetazoline or any sort of vasoconstrictant, it's not for routine use.
I got you. Is there any like obviously like some of like the allergy medicine stuff, they come in pill form? Do you recommend any of that stuff, or is it probably like the best thing is to go right to the source?
So, with allergies, it's extremely important that people treat the allergies. So that's just half the ball game. Yeah. So if you just neglect them or deny them, they're going to come at you with a vengeance. And so I really believe in hitting saline. Their Flonase and some other nasal steroids are now over the counter. Those are helpful. The antihistamines are helpful. The only thing I shy away from a little bit is the decongestant, because the antihistamine with a decongestant is going to cause, number one, it's going to cause a kind of a drying effect on the tissue itself. And so great for a patient who's running, their nose is just running constantly because of allergies. But if you can get away with just the antihistamine, regular antihistamine, that's what I prefer. So limited use of the D containing products. Anything that came to the D has pseudoephedrine in it. And so limited use of the pseudoephedrine containing products, routine use of the antihistamine by itself is fine.
Yeah, and then we just kind of skipped this real quick, but what obviously, like, you use it spot initially, like when you're on ramping into the nasal world, but what is considered abuse? Like, obviously, like every day, yes, but like, is there like a threshold of use that is?
So typically, if you look at the bottle says about 3 to 5 days. What happens is when you put that spray in there, you have shut down the nasal cycle. Okay, so both sides constrict for 12 hours. Now they only work for 4 to 6. Okay. So now you've got something that works for 4 to 6 to work for 12, and then you do 24, then 48, and then all of a sudden they're not going to argue with who gets to take a break first. They're both going to swell up at the same time. So all of a sudden you're like, I got to keep using this stuff. I'm totally congested. Like, that's a normal withdrawal response to stopping the medication. If you've used it 2 sprays in the morning on each side, 2 sprays on each side at night, and you've done that for 3 to 5 days, you can expect to have withdrawal rebound. So typically in those situations, I tell people, that anything longer than 5 days, you're going to run into problems. Right. I see people that have been using it for years.
Yeah.
And they're using it like every hour just to be able to breathe through the nose.
Which I feel like that's it's not a fool's errand. Like, I think they want to breathe through their nose, but they're doing it the wrong way to that extent. Because we try and circumvent the nasal decongestion a little bit, because a lot of times it's again, same as like the long-term exercise of the nose. It's lack of patience. Like you say you can't breathe through your nose, so you default to the mouth, or you settle for it in that concept. So we'll try and get a little more of the nitric oxide stimulation, but if one side of your nose is clogged, obviously, or clogged, or that cycle is constricting that side, or that side's resting, sorry. We have them hold the closed side and then just basically only give their body one option, or one orifice to breathe through, which is that one nostril. And if you do it with enough patience, usually around 5 minutes, and then we'll work in some like exhale holds at the bottom to like accelerate it, because like obviously like that generates your body's adaptive response to the carbon dioxide and things like that are happening. It helps the nitric oxide pool a little bit better from the nasal cavity as well. But usually we get a pretty high success rate with like creating that adaptation if you're patient enough. But I just think some people don't understand the patience that it takes.
Right. No, absolutely.
Then the nitric oxide process in the nose, like I know like book terms, et cetera, like those kind of things, and like I understand what's happening. How is the nitric oxide like truly created? And then do you see I guess people that don't, I guess that would kind of cross over like out of your world, but like can you explain the process and where nitric oxide is produced in the nasal cavity?
So with regards to nitric oxide is typically a vasodilator.
Yep.
And so it's used a lot for erectile dysfunction. That's where it got its mainstay. Also used a lot in cardiac patients. And so by increasing blood flow and restoring kind of probably the health of the nose, to be honest with you. I'd have to really look into that. You're way above me as far as your knowledge on the chemical aspects of what's going on in the blood with regards to that, but it is typically a vasodilator. So
yeah, it's also in all my pre-workouts as well. Like, and then then I try and take the Beat Elite supplement as well, because it works as a vasodilator with a nitric booster too. So like that, yeah, it's just ways to manipulate it, but that's just one of the benefits of breathing through your nose is access to that natural ability to vasodilate your own blood and oxygen absorption, those kind of things. Like that's the massive goal, because again, like long story short, like overbreathing is a problem. Like if you're, I've explained this on the podcast before. I don't know if I've done the SpO2 analogy, but like it doesn't matter if you're 100 pounds or 400 pounds. If you put an oximeter on your finger, same as you have, like if you have COVID in the hospital with the oximeter on your finger, or like if you're an athlete going through a physical, they usually check it just to make sure you don't have pulmonary issues. But your oxygenation of your SpO2 is going to be 99%, usually 97 to 99, unless you have some type of respiratory disorder. So like that is like kind of like was a light for me, that it's like it's not oxygen. Everybody has enough oxygen available, because the only benefit of the mouth is oxygen in and out faster. So basically what we try and illuminate with that is like, you need to change your relationship with carbon dioxide, which obviously the nose does over time. And especially if like you touched on it briefly, where if you're breathing through your nose, I'd be interested at your numbers, just from what I've read and studied, is that like the nose is potentially 50% more resistance to go through the nose than to the mouth. So like that in and of itself, it forces a stronger respiratory response to inhale. And then it also it takes longer to fill up the entire lung, longer to exhale the entire lung, which we're not living in the zero. We're not exhaling all the way and inhaling all the way to 100%. It lives in that like kind of 30 to 70% window. But we want to make that process slower. So eventually we adapt to like another step up of carbon dioxide, which is healthier, which keeps us vasodilated, which is the nasal breathing working. And the whole point of what I'm saying is push people towards nasal breathing, is because there's 8-10 more benefits than the mouth. So the nitric oxide, great one. Clean, humidify the air, great one. Lower breath, like you can breathe diaphragmatically a little more structurally sound, like all these things. You get access to the better oxygen at the bottom of the lung. These compound benefits show up. But like I can't remember where we started on the front end of the conversation or this rant, but these benefits of the nitric oxide thing, these are just the push to keep you in that world. But like people don't usually understand the entire benefits. So like when I coach it, it makes it easier to like story tell it through the pooling and like the patience and like all, and the exposure over time.
Well, it kind of goes back to like, if you looked at in the breath, he talks about looking at animals in nature. And when you see a lion going after an animal, it's not sitting there with his mouth open, gasping, it's breathing through its nose. And so I think I think we touched on this too, is if you look back to nature, the answer is there. Like, this is the way we were supposed to be. And I think with our intellect and changes in diet and industrialization of our world, we've changed our facial structure. It has become more narrow. We've compromised the mid-face. And so we are unable to really successfully breathe through the nose as we probably should. When you do that and you breathe through the nose is when you stick your finger in your tip in your nose, that is the most narrow part of the entire airway. And you're putting that right up front to breathe through. And it's kind of like breathing through a straw. If you're going to try to increase your endurance and workout, you can't sit there and suck in and out real quick on a straw. You're going to die, right? You have to really in and out. And what you're doing is you're working those intercostal muscles. So you're training those, you're expanding your chest volume. The other thing too is that you're slowly inspiring to where you're actually using lung volumes that we never tap into. We're usually riding like right in the middle, like up and down these short, shallow breaths. When you really go to like in inspiration comfortably, and then you try to take those 3 or 4 sips more and really expand, and then you slow outlet. And when you get to the bottom, even constrict that, that's when you start to really use your entire lung capacity. We're not even using, but maybe a mid-third of it on a good day. And so I think what nasal breathing forces you to do is to get that oxygenation, you have to be slow and controlled. And that's what it does. It forces you to just really use that entire lung volume for oxygenation. So I think that's where all these benefits kind of start coming in,
Yeah, that's I love to hear it, just because we preach it nonstop with the Mind Strong project. But the ability to breathe into your full lung, like a bigger lung or a bigger access to your lung means a slower breath. And then like your respiratory rate is one of the tones that control your psychology and protect keeping your wits about you. Because like obviously, like we say, like the breath and the heart rate are like a wind chime. If you lose control of them, like you get emotional, you get reactive, because like that's primal sympathetic state that you're putting yourself in. So like the more you can slow your breath, the more you can keep your peace, per se, both in endurance and exercise, et cetera, but also in day-to-day life. We should access this. And then like mechanically, like I should be able to breathe low 360, protect my spine, like all these compounding issues that can lead to higher FMS scores and all these incredible benefits. So it's just, I feel like people are starting to open their eyes a little bit in that world. But like, I loved your analogy that like, look at nature, and we've talked about it, but we preach it all the time as well, where it's like, and I actually, I gotta shout out your brother on here too, Duncan Butler, the real dog. That's how I met Alan initially. His brother's just a legendary human, just a great human being that I've met through the Sornex family, that is just an electric factory human. But so when I was telling Dunk about kind of what we do and how we do it, I basically just said, like, he did, like, I don't know, I don't think he was too interested in all the science and whatnot, but I like basically like just be a dog. When we say it all the time anyways, when we're competing and training and talking to the boys. But when you look at nature, like a dog is an incredible example, because everybody knows dogs very well. And we actually respond to their physiology as owners. So like if a dog's like amped up and anxious inside, what do? We go and run it. Like it's the same with a human. Like if you're anxious and your anxiety is building, things like that, let's go work out. Let's expend that end of our human and our animal, because we're just animals at the end of the day. And then it shows up when you go out and run them, like, or you're throwing a Frisbee or a ball to them or whatever it is. Like they'll tell you when they're tired. What do? They start panning, the tongue's out, their mouth breathing. But until then, like they're just ripping and rolling. So like now you have a metric on their physiology for, okay, let's get them some water. And then you bring them home. What do? Like their physiology's taxed. They eventually get to mouth breathing, and they go to sleep. Like that's what you're supposed to do. Like when you exhaust yourself, you rest. Like work, rest, balance, all that. Like, and then a lot of it's indicative. We read it on our dogs and their anxieties and their respiratory rate. And I think we should do the same. And like that's the awareness and the triggers we were talking about at the beginning of this. But like I love saying that, and I wanted to shout out for the record. Yeah.
That's probably an energy pack is probably an understatement of the year.
Oh yeah.
I refer to him usually as my human Valium. You know, he's always just so positive, so upbeat. Just, I mean, every time you're around him, you're like, this is gonna be a good time. We're gonna have a good time today.
Yeah, I need to get him on here to explain the art of living in general, because he kills that side of life. But yeah, he's a full juice box, as I usually call it. But as far as like, because like obviously like a massive part of your world is the nose. Is there like any effects that show up on the mouth breathers of the world that like are just detrimental to the mouth and throat airways, things along those lines?
So let's go back to like early childhood. You know, so a lot of these kids will have nasal obstruction from large tonsils and large adenoids, and the large adenoids sit in the back of the nose and completely block these kids up. They never breathe through. They cannot physically breathe through their nose. And so as that child develops and goes into say, from infancy to say early, teens, their facial structure, their midface is totally changed and altered. They have midface hypoplasia. So if you looked at their profile, you see that there's not this significant difference where the nose comes out, midface comes out. They're just flat. They look like they ran into a wall. That's called adenoid facies. And so even in a lifetime, early on during that growth phase, we can cause problems with facial growth. And so that's hard to make up for. Then you're talking about kids getting maxillary advancements, these horrible surgeries and all kinds of stuff just to try to correct that. So that's one thing. The chronic mouth breathing typically is related to obstructive sleep apnea as we age. And so these people don't breathe well through their nose, and that may be just habit, or that may be anatomic issues, or that may be allergies, what have you. But they chronically breathe through their mouth, and they chronically obstruct, and that doesn't necessarily affect their nose as much, but does put them at, when people have obstructive sleep apnea, they will pause in their breathing. If I asked you to stop breathing, you probably would have a hard time dropping your O2 saturations more than 4, maybe 5. If you're really, really mentally driven, you could drop it. These people would drop from let's say an average of maybe 100 or 98 to 100. They'll drop into the low 80s. And that's overwhelming air hunger. Yeah. And so what it does is it ramps up the heart rate, it ramps up the blood pressure, and they're constantly jacking that up to these emergent hypertensive episodes where the heart is just totally be intact. Over time, that puts them at significant risk for heart attack, stroke, early death. And so, and some of that's related, a lot of it's related to obesity as well. So I forgot about that. But
yeah, and I kind of got away from this on my rant, but like the over breathing concept that I talked about, because you referenced the SpO2, the oximeter on your finger, the over breathing, what happens when you have too much oxygen available, like the veins and arteries don't need to stay vasodilated, they'll actually constrict, and you'll actually have less a tighter freeway for all these cars, these red blood cells and stuff to fly. So like that's where like some of the compounding benefits of that is that lowers your aerobic capacity massively. And like, absolutely. Yeah, so like that's where like that shows up. And then an
interesting thing too, Brian, I'm sorry to interrupt, but
yeah, you're good.
What you're talking about is that CO2 tolerance and getting used to that anxiety. When we put people, like I do a lot of stuff on the airway during surgery, and I'll take the tube out of their throat, so they're not getting oxygen, and they're paralyzed, so they're not bellowing the diaphragm and breathing in oxygen, and they will maintain the oxygen levels. I mean, an old dude, 70 years old, not in great shape, they'll kick it for a good 2 minutes, 3 minutes without dropping it a percentage point. So it's never the oxygen that we're having problems with.
Yeah.
While we're awake, it's the psyche and the tolerance of maintaining higher and higher CO2 levels. That the deep divers are able to dive deep like that, right? Long distance runners are able to tolerate, that CO2 tolerance, and so that's a big mental game. But to get that there, you have to, and I think that's what the part of it is what the nasal breathing does too, especially in your world as far as training. Is it gets them used, because when you're breathing in, you're retaining all that CO2 that you want to breathe that out as quick as possible, right?
Yep.
And that's why it's so hard at the end expiration to wait so long, right? Because you want to breathe out all that CO2. And that's where I find when I'm doing, say, box breathing, that's the hardest portion for me. If I'm doing really long, like trying to do 10-second, 15-second intervals, that's where I really start to get swirly.
Yeah, no, it gets super fun. And like that's the true thing is it's training. And like you need to, like, you don't go into the gym to train all your strengths. You go there to train your weaknesses, and a massive weakness is your CO2 tolerance, because you don't know, some people don't know what it is. And then two, it plays with our fear of suffocation, which is a massive fear, which triggers higher heart rate to respond, those kind of things. Which is why I like your sleep apnea analogy, where like the physiological responses to those dips and oxygenation. Because we play around a lot in the hypoxic world, and hypoxia is just like low levels of oxygen availability, and like the oximeter on your finger can trigger like in the hospital, they consider hypoxia like 91 to 93. I've seen it different places, and I've heard nurses and doctors say different things as well. But like part of that little gray area is whether or not they put you on the mat, or like I'm blanking on the
nasal cannula or mask.
Yeah, like when they bring you on, yeah, like or when they were treating people with COVID for these the things they built everywhere. I'm blanking. I'm just being dumb.
Ventilators.
Yeah, the ventilators. Like that's part of it. Like so until like some hospitals, I think it's 91. Once you hit 91, they'll put you on one, and then like 92 to 93, like sometimes you have to have your family sign off to put you on a ventilator. But like when we get into the hypoxia training and things like that. Which is where you say like people will dip down into the 80s and sleep apnea, which is scary. I actually had sleep apnea, particularly showed up when I drank alcohol to excess. People who were around me would say that I'd like hold my breath for 30 seconds while I was sleeping, and then like come back to life like Frankenstein and things like that, which is terrible. And like I didn't know the detriment, because I found the mouth tape when I was still playing. But I used to get frustrated with my whoop scores. Like I'd try and sleep. I'd be trying to be a pro and sleep for 9 hours, and it'd say I'd sleep for 5, 6. And so like that caused me anxiety until eventually I solved the problem, which was the mouth tape. And then my recovery scores bounced back. So like, that's why I preach the gospel of mouth tape. But now, like as we or like after I saw that problem, I started learning in this world, and that's kind of how my business partner Harvey Martin also found it at the same time. We started playing into deep hypoxia, both with movement and extended holds, inhale holds, exhale holds, and things like that, where we could get our, like, I don't recommend this to the average person, but we could get our SpO2 down to the 60s. and those type of deals, like it builds your tolerance. It's literally like an alcohol tolerance, since we already made a drinking reference. That like once you reach this level, like a lot of time, like things are changing as well. Like, but if you take yourself to dark places in the hypoxia world on the holds, eventually enough repetitions will squeeze your spleen where 8% of your red blood cells are kept, and you'll get a little more access to red blood cells to help. But the tolerance is literally just like the more you drink alcohol, the more you can drink alcohol, the more you can experience CO2, the more you can experience CO2. And like that delays the the CO2 helps get oxygen to the cell, because it's a stable or like a fragile little balance with the Bohr effect. But that tolerance becomes, that's where the long-term guys, like some of our athletes some over 30 are PRing in VO2 max with only changing breath work. So like the proof's there, but it's just like it's a weird relationship to train, because it's one, you're playing on your suffocation fear, right, which I think everybody has. I think it's probably one of the strongest fears in human nature. And so like that can trigger different responses, but it's all repetition. Like everything in the breath world's repetition. Same with like breathing low, breathing into your ribs, creating space, and like even like the sips of it, like once you're already full, creating more sips to create space, and all these things, larger lung, good mechanics, strong diaphragm. And then now you get into the CO2 tolerance that comes naturally with the nasal breath. And then now I love box breathing as well, just to like calm myself down, and I use it to build CO2 tolerance. It just ends up becoming like this addictive world, because now like your brainstem reads stress and anxiety with some level of carbon dioxide. So now if you can become more tolerant to that, leads to like obviously the slower respiratory rate and all these benefits of good cellular exchange lead to less stress and anxiety anyways. But like the physical stress and the mental stress are registered relatively the same. So absolutely. Yeah. So like that understanding is like, if I can train my CO2 tolerance physically, yeah, great. You reap the PEDs, reap all the physical benefits. But like, I think the massive problem now is all the mental health awareness is great right now, but let's solve the problem with a medication. It's literally carbon dioxide. Like, let's become really tolerant to stress in a controlled, active state. And I'm ranting now, but like, I just think it's just it's simple and massively significant. I say that. But
so it's almost, I mean, we're intellectual beings. Yeah. And I call it the lizard brain. I mean, our lizard brain is our brain stem. And that's where you don't have to think about breathing. You just breathe. Your body just breathes for you. There's something called Pandora's curse, and people, they forget to breathe. So they have to consciously think about breathing all the time. Okay. That's a nightmare. But we just go through the motions, and our brain is constantly our brain system is telling us to breathe. But what we can do is override that, and by controlling the breathing, it's like reversing. It's like, reversing the who's in control. Like now I'm in control, because I'm controlling the lizard brain and controlling my anxiety by controlling my respiratory rate. So it's just the feedback, as opposed to it controlling you, you're controlling it.
Yeah, that's my favorite bit, is just to pull as much into consciousness as we can. And like, I just think that leads to like a well-lived life anyways, because like the more that we think things are outside of our control, we're not going to change them. We're going to avoid them. We're going to do all these things. But like now, and like, that's why I love the podcast anyways. Like, I learned a bunch on this podcast, but also like that, like now I have new things to be aware of, new medications, new like tactics. Like I'm trying to pull as much, but like the breath is the only thing in the system, the autonomic nervous system, that we can control. So we should have massive consciousness there, because now it's endless tools to manipulate performance and control your state. And I think any human, no matter like whether you're the happiest human in the world or your life is in massive limbo and trauma, like control at either end of the spectrum is only going to make you a better human. So like, that's where that's why I fell in love with the breath world, but that's also why I love learning from guys like you, so that I can keep learning and growing and sharing this world. And I think this conversation smoked that. So I don't want to keep you longer than an hour, but I appreciate your time for sure. You're a stud.
Brian, it's been a pleasure. I really appreciate it. And I've learned so much from you. And I think it's just exciting, because I think you're going to be one of those cutting edge people that's going to change the face of how we look at athletics and performance, and even just our mental psyche in general. And I think that breath is the key component to that. It's the first and last thing we do in life.
Yeah, that's a savage line. Yeah. No, I appreciate that greatly. Just before you go, before we log off. Where can people find you? Are you on social? What's your practice? Where's it at?
I'm a 50-year-old man, so I don't do a lot of social media.
I love it. Yeah.
I'm in Gainsville, Georgia. I'm in a group with 5 other guys. We're Northeast Georgia ENT. And, if anybody has a question, I can give you the phone number there.
Okay.
And they can call, leave a message, and I would be happy to field questions.
Easy. Yeah. I'll shoot me that, and I'll add it when I post like the graphic.
That sounds good.
Yeah.
All right, man.
Yeah. You're the man. Yeah. Let me pause this. I appreciate your time though.
All right. Don't be a stranger.
Not at all. Yeah.
All right, man. See you.